And these folks shuffle, but don't have much upper extremity problem. They shuffle a lot and they freeze and those kind of things, but don't respond much to levodopa, unfortunately. And also we have patients with conversion disorder, with psychogenic Parkinsonism that come in. I see probably a couple of years, several a year in my practice that have this condition. I mentioned drug-induced Parkinsonism. I put this slide on here not to scare you, but just to lay it out there on the line. There are lawyers on the web and other places that will sue some folks who get tardive dyskinesia or drug-induced Parkinsonism that's pretty significant from Reglan. I know Reglan's an important drug in the armamentarium for diabetic gastroparesis and other problems, but folks, you got to be aware that it's only approved for 12 weeks. If you are going to have a patient on chronic Reglan therapy, let them know of the risk of these possible orobuccolingual movements, you know, the lip smacking kind of movements that they can get, as well as the possibility of drug-induced Parkinsonism. So just make sure that your patients are aware if they're on this chronically and document it. Okay, let's do another question here. Of what Parkinson's plus condition did Dudley Moore, he's the actor in the movies 10 with Bo Derek, and Arthur, die? Which one was it? Scheidegger, one for, Scheidegger again. MSA. Okay, let's close the poll there. So it looks like that you're all wrong. It was PSP. He was on, I think, on Lifetime or A&E recently, and it showed his life as he went down from PSP. He was knighted, I think, later in life and had the PSP pretty bad at that point. But he had lots of falls, extreme dysarthria, can't look up and down, those kind of things in a setting of Parkinsonism. But poor fellow, it got him very quickly. And we're doing some research now, finally trying to slow this disease down. But it's one of the bad brothers or Parkinson's plus conditions that we can't do much about. Okay. Well, what are the treatment options today in Parkinson's disease? Well, we can watch and wait. There is some evidence now that that's becoming less of an acceptable option. We're learning now that probably treating as soon as someone is diagnosed with Parkinson's is the best bet because folks who are treated earlier do better over the long haul, at least over the first couple of years from a couple of studies that have come out recently. You can refer folks for clinical trials, and also you can give them medication or rehabilitation therapy with OT and PT and et cetera, and other speech therapy for their soft voice. There's a great technique called the Lee Silverman voice technique for that. And then some folks need surgery. Used to they get pallidotomies, or like Michael J. Fox, I don't think he had a pallidotomy, but he had a thalamotomy that helps with tremor years ago. But now we have deep brain stimulation surgery, which I'll talk about a little bit, for advanced cases. They're actually doing a clinical trial for early patients too, so we'll see if that is useful for them and safe. And also there's some complementary therapies. The two complementary therapies I want to make sure that your patients steer clear from. Number one is glutathione infusions. Nothing but a moneymaker for doctors. No evidence that it does significant penetration to the brain, and not worthwhile. And I've had patients spend thousands of dollars on it. It's really just a money-making scheme, in my opinion. Chelation therapy is the other thing. Chelation therapy is great for folks that have heavy metal poisoning to pull out heavy metals, but not anyone for Parkinson's. No. Folks can actually have significant side effects from it, and I would steer clear of those too. Yoga, other kind of different exercise therapies, sure. And exercise, important in PD. We're discovering that exercise may actually protect dopamine neurons from being lost. Okay, let's do another question. Which of the following drugs is the most effective for Parkinson's disease? Dopamine agonists, amantadine, anticholinergics, or carbidopa-levodopa? And actually, this drug causes dyskinesias as well. Okay, awesome. You all got it right. So carbidopa-levodopa is also known as Sinemet, or Sinemet CR, which stands for controlled release. Carbidopa was added to levodopa. Years ago, they had to give like 4 grams to 16 grams a day of levodopa before you added the carbidopa on there to inhibit the enzyme dopa decarboxylase in the periphery in the body. Also, folks vomited their guts out with lots of levodopa. And adding the carbidopa reduced the peripheral breakdown and the nausea associated with it. So this drug's been around since the early 70s and is still the most effective drug we have for Parkinson's disease. Unfortunately, if you take levodopa, you are at risk of developing dyskinesias, those twisting and writhing Michael J. Fox type movements that he has. And 50% of patients at 5 years on levodopa develop these dyskinesias. Anticholinergics are still useful, especially for tremor, like trihexyphenidyl or artane or benztropine, cogentin, and amantadine, the brand name Simitrel, can be helpful for dyskinesias or Parkinson's in general a little bit. And dopamine agonists of various sorts can also be quite helpful in the treatment of patients with Parkinson's. No other drugs on this list besides levodopa cause dyskinesias as monotherapy. Okay, so I mentioned the anticholinergics. They're great for tremor. Amantadine was discovered to help significantly with dyskinesias years ago. You maybe remember this drug as an anti-flu drug. It may still be used some for that. Selegiline came out in the late 80s, early 90s as a possible disease-slowing therapy, but we're not so sure about that now, given various reasons. But Prostagiline is the new kid on the block. There have been a couple of big trials with Prostagiline looking at possible disease-slowing mechanisms with this drug. And in my opinion, I think the jury's still out if it's disease-slowing or not. They did a delayed start design, starting folks on it early or after 6 months or 9 months. And the folks who were started earlier did better at, throughout the trial than folks who were started later. So is that neuroprotective or not? I'm not sure. I think it just means that treating patients earlier is a better option for them in the long run. Dopamine agonists that are still on the market include pramipexole or Mirapex, Ropinirole, which is Requip. You may have heard these more recently for the restless leg stuff. And bromocriptine, or Parlodel, which is an old ergot-derived agonist. I don't use any bromocriptine or the old drug called Permax Pergolide because these are ergot-derived and can cause fibrosis. Sinemet or carbidopa-levodopa, everyone's going to be on at some point in their illness if they live any kind of time with Parkinson's disease. And another helpful drug in reducing motor fluctuations that is wearing off of the Sinemet is entacapone, and it can be prescribed alone with levodopa, carbidopa, or it can be prescribed in a single tablet called Stalevo. Well, the drugs work at different spots in the brain. I won't belabor this, but some work outside the brain and inhibit peripheral breakdown of levodopa so you can get more of it into the brain, as you see there on the bottom left. And some work inside the brain, either presynaptically or postsynaptically, like the dopamine agonists do postsynaptically. Apomorphine is a neat drug. Apomorphine is a neat drug in that it actually is an injection and can really help folks that have significant wearing off and are suddenly turn off and can't move. L-Dopa was originally abused and actually used as a stimulant for some folks. And you may have seen lately that there's these gambling and hypersexuality issues with these dopaminergic medications. Even L-Dopa can cause these kind of issues. And as you see here from this LA Times advertisement, they made a movie to help women and men through the problem years with L-Dopa. So pretty interesting. Levodopa has some strengths. It's the most effective symptomatic therapy and certainly improves disability and may prolong life expectancy. But as I mentioned, that folks can develop these dyskinesias, the twisting and writhing movements. About 80% of folks at 10 years or 85% of folks at 10 years